Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week. I hope everyone is enjoying their weekend and has had a great week. I spoke at Monmouth Worship Center on the By Design Ministry Tour, as I call it. For those of you who are part of a church or an organization, I've basically donated about 12 By Design 90-minute workshops to church groups. We do these as fundraisers where people give love offerings for a variety of centers or services. In this case, we did a fundraiser for Solutions Pregnancy Center down in Shrewsbury, which I serve on the medical board on. And it's a wonderful nonprofit in Shrewsbury, New Jersey. So By Design is kind of coming out of the radio and going live. So if you have a church or a church group, please, you could contact me directly through my email, which is jproodian@naturalhc.com. Well, I hope everybody had a great week. We're going to be taking a look at coming out of the last 8 months, just a quick look back on 2014. If you guys remember, we started this year off by creating a health journal. The goal was that everybody went and bought a little journal and started to write down notes. Well, I wanted to take time and let's take a look at what we've done so far this year. The goal was to write, articulate, and create an individualized wellness lifestyle for yourself. Now, today is my 99th show. So far this year, I've done about 30 shows in 2014, which is about 8 hours of content. So if you guys look back over that 8 hours, we've gone through what metabolic syndrome is. We've discussed pain and inflammation. We've discussed change and transformation through brain chemistry. We spent a lot of time with Dr. Amen's book. We talked about gluten and wheat and being part of what I call the counterculture. The counterculture meaning that chronic illness is a tsunami that has taken over the country and the world, which I'll be discussing today. And the cost of chronic illness, most of which is man-made, meaning that chronic illness, the invention of chronic illness and the statistics behind chronic illness has really strangled healthcare and healthcare workers, so that 18% of the GDP is currently being spent on health care. So 18 cents of every dollar spent in America is spent on health care. By 2040, that will be 34%. So 34 cents of every dollar is going to be spent on health care. Now, 75% of all the health care delivered in our country is due to chronic illness. So just stay with those stats for a second. You could see that we're spending 18%, 75% of that is spent on chronic, which is the opposite of acute care. Now, acute care is like when you break your arm or you have some sort of accident and you go to the doctor and they fix you up. That is pretty much what our system, our healthcare system, our medical system was designed to treat. So we've got a real problem going on, which is why so many of you in your workplace or if you're a small business owner like myself, every year you have to, redo your healthcare insurance, and the costs go up every year because we're paying for this chronic illness. So I want to step back and say, well, where did it come from? Well, most of it, like I said, is man-made. We have created the chronic illness epidemic. So when we look at that, and we're living, hopefully, as part of this counterculture, the counterculture basically meaning that the world or the country has its sights and its day-to-day existence in the physical, the nutritional, psychological world. That doesn't mean we do. Just because man has told us to eat a certain way doesn't mean it's good for us. Doesn't mean just because man has told both men and women that you have to work as many hours as we do, drive yourself pretty much into submission, get to adrenal burnout, burn out the thyroid gland, go into hormonal dysregulation, so you end up exhausted with a chronic condition by the time you're in your mid-40s and 50s, that you're going to live with it for the rest of of your life. That doesn't mean that that was the model of science, of biology, of biochemistry that God created for us. So the By Design program this year has been very serious. I wanted to take a very serious look at what your wellness lifestyle, my wellness lifestyle, should be. So we're going to dive into some chronic illness today. We're going to be spending some time with a book called The Disease Delusion. And this is a new book written by Dr. Jeff Bland, B-L-A-N-D, and I cannot recommend Dr. Bland's work enough. He's the founder, the father of functional medicine, and just a fascinating book. Before I get going there, I do want to just touch base on gluten. Last time when we were talking about gluten, we talked about how man has changed wheat and how wheat contains far more gluten today than it did during biblical days. One thing I want you guys to be aware of, if I didn't mention this, is when you go and get your blood test, and I would recommend getting celiac disease. As much as you don't have celiac disease is an autoimmune disease, and it's a very serious autoimmune, and you're saying, well, Proodian, I don't have celiac, why should I be tested for it? Many times when you run what's called DQ2s and DQ8s, these are what you're looking for in hematology in the blood. They'll come back with one of the markers positive. That doesn't mean you have celiac, but that is a way to test. We talked about how to test for a gluten sensitivity, not a gluten allergy, but a gluten sensitivity. I, for instance, have one of my markers that came back positive. So I avoid gluten because it does have an impact on my body, but you may want to ask your doctor as you go through this wellness lifestyle, and I've been throwing a lot of blood chemistry at you this year because we want to be thorough with our blood tests. And if you need a hand with that, you're welcome to come and see me. So when we talk about chronic illness, and we've been speaking this year about metabolic syndrome, the amount of pain and inflammation people are in, the way brain chemistry is greatly affected in chronic illness because it's under a constant fight or flight response, and the way gluten and wheat specifically, has been altered by man. Let's take a look at what chronic illness is. Chronic diseases, guys, illnesses that they make you sick and they never really go away. Their nature is to stay with you, okay? So the nature is to stay or come back over and over again, okay? Now we try to manage the effects and find occasional relief from them, but it's not like we could zap them like we do with an infection. You get a sinus infection, you go to your doctor, you get an antibiotic, you zap it with the antibiotic, and it goes away. Chronic disease works differently. It's with us. It drains us. It saps our energy. So some of these diseases, I'll list them for you, are things like high blood pressure, type 2 diabetes, gout, dementia, autoimmune disease like rheumatoid arthritis, neurological disorders like depression, attention deficit disorder, autism, digestive diseases like gastric reflux, ulcers, inflammatory bowel, bone loss diseases like osteoporosis, obstructive pulmonary diseases and asthma, for instance, muscle pain and weakness from chronic fatigue syndrome or fibromyalgia, kidney and liver ailments, vision problems like macular degeneration, and of course, cancer. So these chronic illnesses are with us. They're like luggage. You can never get rid of them. They're just wearing us down day in and day out, month after month. You go to your doctor, a pill for every ill, treat the symptoms, send the patient home. That's pretty much the way our society has managed and dealt with chronic illness. And once again, the cost is staggering. So as I lecture in corporate America, and I'm teaching CEOs and CFOs and CEOs for 20 years now, that their role in combating chronic illness, they're not doctors, but their health insurance is skyrocketing because they have such a sick employee base. So where I come into an organization is to sort of get some information into people so they start living a wellness lifestyle like you guys are doing. So let's get back to chronic disease. What are the 4 characteristics that Dr. Bland outlines in his book? Well, chronic illness does not heal itself. Okay, so these are not self-limiting disorders. A self-limiting disorder is like getting the common cold. You get the common cold, you go to bed, chicken soup, 7 to 10 days. It's self-limiting. Not so with chronic illness. The second characteristic is that the illnesses grow worse over time. So we could kind of stick a Band-Aid, I call it Band-Aid therapy, give medication to make the patient feel better. The medical profession does that. They're making the patient feel better. And as the patient ages, the chronic illness many times gets worse. It's not like we're going to return to a healthy state. It's an ongoing management system of recurring episodes. So we wait for the next episode of, let's say, irritable bowel syndrome to hit, or Crohn's disease to hit, or the impact of Hashimoto's, or hypothyroidism, or rheumatoid arthritis, and then we treat it. We go to our doctors and we treat it. And that's very common with the way we manage and treat chronic illness. The third characteristic is that chronic disease does not have a single cause. So it's not like you can't point to one thing. See, chronic disease has several factors or agents that sort of rise up, okay, and create the chronic disease. The fourth chronic illness characteristic is that these are very complex symptom profiles. Okay, the sick person has a number of different complaints, and there can be a variety of illnesses happening. So, someone with rheumatoid arthritis many times is also hypothyroid, and they have a bowel irritation. So they're having trouble with their gut, they're having trouble with their joints, and they're having trouble with their endocrine system, their thyroid system. So it's not a simple stick a Band-Aid on each one, send the patient home. It's a complex mechanism. Many shows ago, I shared with you that your body is not single-dimensional. It is a miracle of many, many systems working together in unison. I like to define it as an orchestra. Like when you go see an orchestra play at Carnegie Hall, and everybody is playing together in this beautiful symphony is coming out of these multiple instruments. Whereas my fourth grader, hey, listen, it sounds nice, and I think it's cute when I go see them play, but I wouldn't want my endocrine system or my body working like a fourth grade orchestra. It's not exactly music to my ears. So you want your body working as a system. System works together, like I use the analogy of your car. Your motor has multiple parts working together to make the car run. So this is very complex, but it's also very common. Chronic illness is very, very common, and it has a number of hard to specify causes, but no single origin. So chronic illnesses are increasing. The conditions increase, and we have to live with it. The symptoms increase as we age, and we have to live with them, and more of us are doing so, and this is very, very expensive. Okay, this is not like treating acute illness. I break my arm, I go to the doctor, they cast it, I see him or her a few times, and I'm finished. That is not the way chronic illness works. So the cost of this is staggering. And as we age, we spend so much of our time going to doctors and popping pills. And I think that many of us out there are either living like that or know someone who is living like that. So a little while ago, I did a show on what I call the pyramid of health. And this is something I published a little while ago. When I sat down to do my very first show of By Design, I put the 8 characteristics on a piece of paper, and I built a pyramid around these foundational subject matters. And those 8 foundational subject matters I took apart my very first shows. So if you go to my YouTube channel, and this is, I don't know if I was very good on the radio back then, I'm trying, pray for me, Luke 1:37, for with God nothing is impossible, and I'm really trying here. But what I'm saying is, if you go back to those shows and you read those foundational subject matters, inflammation, for instance, epigenetics, structural health, stress, energy production, those are just 5 of the 8. They work as the foundation of my show, and they're all interrelated, and they all work together, and those are the 8 principles that break down to create chronic illness. So a doctor, therapist needs to be working in functional medicine on all 8 of those properties. All right. So that's the definition of chronic illness. They don't heal themselves, number 1. They grow worse over time, number 2. There's not a single origin of why you have the chronic illness, number 3. And number 4, they are very complex. So if you're dealing with a chronic illness, the good news is there is hope. There is reversal of these conditions. You could actually treat these conditions, but it takes a very different way of thinking than a pill for every ill. It takes a very different way of thinking than a single origin thought process. And I hope I have made that point crystal clear. You can go to functionalmedicine.org. You could put your zip code in, find a doctor, and there are some great clinicians throughout the country working like this, because you want to look at these diseases, these conditions, and these chronic illnesses from an origin perspective, which is very complex, and work backwards. Many times you have to work backwards from the condition. Well, I hope you enjoyed today's show. Thank you for listening to me, Dr. James Proodian, in the By Design episode. If you'd like more information about me, please go to ProodianHealthcare.com. Have a blessed weekend, a blessed week, and may we all start looking at chronic illness from the very fact that most of it is man-made. God, gave us a miracle of life, and it's our job to create a wellness lifestyle. Write these things down in our health journal, and let's really impact our well-being for the glory of God. Thank you.